governor sworn into Nairobi County.
Yes.
The history shows that there's been a love-hate relationship between the county government and the Nairobi Metropolitan Services. So the question, a simple question people are asking is, who's in charge of Nairobi County right now?
I can't answer that question. I think, of course, for me, I'm very well aware of where my instructions come from, which is Lieutenant General Buddy.
Did you listen to the Hot Breakfast this morning? Here's what you missed.
On today's interview, folks, he was the outspoken Secretary General of the KMPDU at one point, and then he got appointed as Director of Health Services in Nairobi, and now all is quiet in the KMPDU front. What happened? But he is no doubt the Director of the Health Services and Health in the capital city. What is the state of health? In the studio, joining us live, Dr. Ouma Oluga, talking about health in the city. Karibu sana Daktari, welcome to Hot 96.
Asante.
How you doing, man?
I'm doing good. How are you doing?
We are very good.
Yeah.
Yes,
Nick.
We noticed. Fantastic. We noticed you've been very quiet since your
doctors are not normally very vocal.
Exactly.
But this one, they are more of action, isn't it?
Yeah, we work. I
don't think Jeff knows many doctors.
I think he does quite. But he knows only Dr. Dre.
Only doctors.
Dr. Dre.
And Dr. Jose Camilio.
And Dr. Jose Camilio.
Nice one. And Dr. Joshua?
And Dr. Kingang. Dr. Kingang.
Kingori. So, Dr. Ari, the state of health in Nairobi County.
Yes, sir.
Tell us, well, how would you describe the state of health?
Well, it's been a roller coaster. It's been quite some work. We found it a bit wanting, to say the least, and for two reasons. When Nairobi Metropolitan Services was established 18th March 2020, it was just 6 days after the first COVID case was announced. And I think this is important because Nairobi is was the epicenter, and it's still the epicenter. Thousands of cases, from quarantine to guys who need isolation to travelers, and so the city was in some state of panic and chaos at that particular time. But what we found out was that the health infrastructure at that time couldn't take care of anything, couldn't take care of COVID. So even as the president was talking about counties need to have at least 300 isolation bed capacity isolation facilities, Nairobi had none, and so we had to embark on immediate work to improve the infrastructure. In the 90s and in the 2000s, Nairobi didn't benefit from infrastructural development in the health facilities, and therefore with population growth in Nairobi, I think at some point in the day we can do even up to 7 million people. In the night we have 4.5 million people. And so the infrastructure for health was the ones for the 1980s, when the population was 1.5 or 1.2 million. So you have areas in this city which are unplanned. Of course, we call them informal settlements or slums, if you like, with zero facilities. And what used to happen is that all these people then walk to Kenyatta National Hospital because that's their first point of call. Mm-hmm. If you are living deep in Mathare or in Mukuru or in Kibra, or sometimes as far as Kayole, the first place to get care was Kenyatta National Hospital. So the Nairobi Regeneration Report, which was done 2016-2018, was spelling it quite clearly. 47% of all people who are going to Kenyatta National Hospital were Nairobi residents who could otherwise be treated if facilities were near them. And so with COVID and then with this report, we realized that we had to get on work. And that's how we quickly looked at it. Of course, a directive from His Excellency the President that we must do something, and of course with a lot of support from the Director General, Lieutenant General Badi, that we have to embark on work. And that's part of course why I'm quiet, because you just got to work. There's nothing much to talk about. The directives had been given, and for us, our work was to go around looking for these high burden areas, underserved places with no facilities. And we had a very short time to put up these facilities, to equip them, to staff them, and to make them functional.
What happens to the old clinics? Because like every neighborhood in the 80s used to have a clinic nearby, clinic going all the way up to until you get to referral at KNH. Are those still functioning?
They are very functioning. In fact, what we've done, and that's what I was mentioning, we've talked about the new facilities, but we've not talked about the work that we're doing in the old facilities, which is also quite a lot. For example, if you go to Roraka, you had the Babadogo Health Center, which was a small clinic, seeing maybe 15-20 people a day. Now we've expanded it, put double the capacity, putting a theater there. If you're going to Kibera South, which was a facility that was built by MSF and then handed over to the government, again expanded it. In fact, we were using it as our COVID isolation, from 12 beds to 70 beds, and even putting a theater there. Westlands here, an old facility, again expanding it. If you're looking at Kangemi, the Kangemi area, very populated, again doing quite some work there. Waithaka. So there's a lot more work. In fact, there are 10 what we call high volume health centers, Kayole 2, that we are doing a lot of work. Mihango, these are old facilities, if you go to Lunga, we've done a 3-story maternity. These are old facilities that we are also improving to take care of this population growth, but also to expand the scope and quality of the services. So it's not just about the 24 facilities that are new coming up from the ground. It's also about the old facilities in far end of Dagoretti, in a place called Mutwini. I think you may know Mutwini. We expanding Mutwini hospitals with another 80-bed capacity facility. So there's quite a lot of work across board, not just in the new, but also in the old. And we are looking at it at 4 levels. Of course, there's the issue of infrastructure, which is buildings and equipment. Then there is the issue of the equipment in terms of the theaters, the ultrasounds, the x-rays, the laboratories, and then the staffing, which is basically making sure that they have the nurses, the doctors, the clinical officers, the physiotherapists, nutritionists, and all the staffing that they need. And then the last, which is very important, is the community, both from community utilization of the facilities, community ownership of the facility, accountability, and more importantly, if you're looking at sustainability, then you also have to get the community to have financing, which that's why we have also done 66,000 persons who are not able to afford, and we've paid for them NHIF at a cost of 400 million, so that these facilities, we call the poor and vulnerable, or in NHIF terms, indigents, as you're talking about UHC, we are also making sure that the community, the most vulnerable people, have an NHIF card.
I was about to ask you, can anybody walk into any of these clinics? It's one thing to build an infrastructure, it's another for someone to be able to afford.
Yeah, all these facilities are free. I think that has been stated very clearly by the President and also General Badi. And all our facilities are free because they are level 2, they're level 3. And that is why we chose that level 2, level 3. These facilities, even the ones that we are calling a level 3, are actually level 4 if you're looking at the standards of the policy, because they have 2 theaters, which is what makes a level 4. They have imaging services, X-ray, ultrasound, and then they have a laboratory that is capable of doing quite extensive tests like biochemistry, basically kidney function test, liver function test. You're looking at a complete blood count. I mean, for example, the healthcare workers may understand these are services that are found in level 4 facilities, but because we needed to look at access, and access is not just the presence of the facilities, as Jeff you're saying. Access is also the ability of the services to be provided, and then the last bit about access is the consumption and the ability of people to afford, and that's why we've made them level 3, level 2, so that they are free. But also from a policy perspective, free is to the consumer, but there's a cost to it, because you have to buy the medicines, you have to buy the reagents, you have to maintain the equipment, you have to maintain the building. So there has to be somewhere where the money comes from, and the money either comes from taxes or from reimbursements, and that is why we are also making sure that this is sustainable by engaging the communities to take up NHIF, and also by paying for those who are not able to pay for themselves, because then this is now how to make it sustainable, so that when you walk in with an NHIF card, we are guaranteed that then we can have a reimbursement. For now, whether you have an NHIF card or not, the treatments are free, and we've all of these facilities are seeing more than 200 people every single day. Every single day.
And you have enough doctors and nursing staff?
We employed 2,000 healthcare workers. We employed 200 doctors, 179 clinical officers. We employed 790 nurses, including specialist nurses. So I think this was the most massive recruitment I think a government has ever done in the last few months, December. And so all these facilities, each one of them have, if at a level 3, a minimum of at least 51 employees, doctors, clinical officers, laboratory people, and because now we are being demanded, and the president also directed that they must be 24-hour facilities, and that means that we also have to increase the HR. We have to increase the numbers of HR. So this is what we are doing, and if you go to Kenyatta National Hospital, you'd see the effect for yourself. I think the numbers there have gone down, and that means that Kenyatta National Hospital can now focus on what a national referral hospital should do, which is to receive patients from all over, the ones that are needing very highly specialized care.
I was going to talk about Kenyatta. So now, like the congestion that happens there, like people sharing beds, 3 people, is that a story of the past?
Yeah, and that's part of why N.M.S came, because we needed to take back those patients. As I mentioned, 47% of those walk-ins were Nairobians, and so if you give them care where they stay, then they don't have reason to walk into Kenyatta. So at least Kenyatta can be reserved for that cancer patient coming from Meru or from Migori, and who already is suffering from the public transport, and they come to Kenyatta, they find a very long line. Why? Because the guy from Kibra has a headache and he couldn't get care near Kibra.
Okay. Is there, plans to open another referral hospital?
Yes, there are plans to open the Mathare Korogosho Hospital, which is the first level 5 in Nairobi, and I think it's complete. Just a few equipping issues. We've already staffed it, and very soon I think that I will leave for the bosses to announce. I think you will see that being commissioned very soon. The first level 5, 350 bed ICU, renal, advanced laboratory, advanced imaging.
It's all ready. I mean,
it's all ready. Yeah.
I was going to say, most of the things you've said is just focusing on the people in the, should I call them low-end neighborhoods, the vulnerable in society. Yes. But also people who have jobs like us and nice neighborhoods also would like not to pay so much for our health.
And that's a good thing.
Oh.
Yeah.
Are we being catered for? Because I don't think I want to go to Kibra.
Yeah, of course. No, you can go to Kibra, but it's a very nice hospital. We are not doing hospitals for the poor. We are not doing hospitals for the poor. We are doing hospitals because these facilities can cater for anyone. But also remember, Westlands is just here. Westlands is not a very poor neighborhood. Well, it's not a poor neighborhood at all. And it's also having a facility. The parastatals that are around it, the people who live there. We are doing a facility in High Ridge, by the way, Parklands. Just here in Parklands, Westlands ward, and that is not a poor neighborhood at all. And so those are the facilities that we are looking at doing corporate clients. We've done a facility at Uhuru Park at this terminus, the Green Park dispensary, which we think can take people who come to work in town. You are taking medications, hypertension, diabetes or something, and you forget your medicine, so you need to refill. You don't have to go line in some expensive clinics. You can come to our place, and these are the things that we are looking at. So it's a holistic approach. Zimmerman, where we've done a facility just next to Thome. Thome is not a poor neighborhood.
So I guess it's just people who don't have the information, basically.
And that's why we are very grateful that you could invite us here to talk about this, because it's important that people have this information, so that it's not just that we are doing a hospital for the slums. Yes, of course, the majority of the population, 3.1 million people, are in the slums, and we have to cater for that population. But also the 23% of Nairobians who are in well-to-do neighborhoods, Langata, Otiende Estate. We have a facility just right there. Of course, it's been an old facility, Langata Health Center. We've just renovated it. Karen Health Center, we've renovated Karen Health Center.
That's near home,
expanded.
I think I will.
Yeah. So now I'm speaking to you. So, and yes, and we are also talking about looking at how we can improve the scope of services and the quality and the perception of services, so that, Jeff, we want you in one of our facilities.
He'll be needing free medicine soon. Let me ask you. Okay.
Yes.
Do you, as the health department, do you also work with sanitation, so that because a lot of diseases in like high density, low income neighborhoods has got a lot to do with dirt. Either there's garbage out there, there's stagnant water, there's flies, there's no sanitation. And if in that environment, you'll be hardy with time, but the vulnerability is on a higher level. So making sure water is flowing, people are clean. Is that something that you guys are working together?
Yeah, I think at an N.M.S. level, of course, we have our Directorate of Environment, and they are equally doing a lot of work. Perhaps they can also, and I think General Badi has talked about this over and over, the investments that we've done in water, sanitation, hygiene. As in health, we have a unit for what we call water, sanitation, hygiene, and they work with our colleagues. So we're looking at mainly, of course, water access, but also we are looking at issues of public health. So for example, toilets, issues of sewer. And I think one of the other things that I needed to mention with these hospitals, which I think has not been talked about before. So you find most of these hospitals have been, where they've been built in the informal settlements, they also attract with them a sewer line, water supply, public lighting in terms of street lighting, and garbage collection. So it's also, in a way, replanning the informal settlements, because if you know Nairobi very well, sometimes it's a bit difficult to go to the informal settlement and tell them, oh, now we want to do a development plan. As you can see, of course, with Mukuru, I think you can see the outcry even with the roads and all that. But you see, when we took the facilities there, and there was a lot of community participation, and they have really welcomed these projects. So when you tell them, but this hospital must have a road, this hospital must have sewer, this hospital must have water supply. So that sewer is not just for the hospital, it also connects with the neighborhood. So then you can clean the neighborhood so that you reduce diarrheal diseases. When water is put at the facility, it also supplies the neighborhood. Public lighting is the same. So I think it's a way to redevelop or replan some of these informal settlements, and I think that goes a long way in hygiene, even in promoting healthy lifestyles, because as you know, in many of these places, the way the informal settlements you have to skip. There's a lot of stagnant water. Nairobi generally, we don't have a malaria problem. But we have a lot of mosquito problems. We have a lot of pest. So pest control is also part of the big things that we are doing in health, not just from an education perspective, but also trying to do as much in terms of spraying to make sure that we don't have bed bugs, cockroaches, rodents, which is a big problem also in the informal settlements, and the landlords, I think, needs to do much more to make sure that people are living in habitable conditions.
Dr. Ari, we all know, as of yesterday, we had a new governor sworn into Nairobi County.
Yes.
The history shows that there's been a love-hate relationship between the county government and the Nairobi Metropolitan Services. So the question, a simple question people are asking is, who's in charge of Nairobi County right now?
I can't answer that question. I think, of course, for me, I'm very well aware of where my instructions come from, which is Lieutenant General Badi, and that's the reporting. And of course, N.M.S. is an entity that has been talked about. So I think those are political questions in terms of the discussions. But I think we all know that the functions were transferred. Some 4 functions were transferred, and N.M.S. is executing those functions, and the ones that were not transferred are being executed by the county government. From where I sit, which is a technical position, we've had a very good relationship. For example, all the employees that we have in health are employees that were employees of the county government, and we've not had any resistance. In fact, all this work that I'm talking about have been done by them, because they put in themselves there, they apply themselves fully, and they work very well. So I think there may also be people who are talking, but I think they don't know the inside story. So on a daily basis, when I leave this show and I go to work, I don't see all these things that people talk about.
You've changed a lot since you became head of public service, health service at Nairobi Metropolitan from your KMPDU days.
Yes.
You've changed a lot. What happened?
I've not changed.
You've been very,
it's a bit soft now.
Soft life,
I've always been soft. I've always been soft.
Let me ask you, after this conversation, a lot of things are making sense. Where does the health department get the medicine from? Does it come from KEMSA?
Yeah, it comes from KEMSA. Mostly from KEMSA.
And the other day they said the military will take over
KEMSA.
It's all making sense now. But I guess I've already put 2 and 2 together.
That conversation.
So N.M.S. mandate, I hope it would end soon, because if
I don't know, I can't comment about that.
Look at today's Daily Nation. Today's front page: budget cut signals end of Buddy's N.M.S. In the 2022-2023 budget, 1/3 of it will be slashed, meaning the end of N.M.S.
No.
That's what it's saying.
Who's in charge? Can you call your cousin?
My cousin. Dr. Ouma, what does that mean for you guys?
For us, we are civil servants and we just work. So that's it. So civil servants, we work with the policies of the government, and that's it. So basically, you tell us what to do and we do it.
But it seems like a thankless job what you do. Here you are saying you've built how many clinics? 17 clinics. There are 13 more.
We have commissioned 15. There are 13 more to go. And for us, I think the most important thing is to provide that public service. I think if you've hosted my boss, the Lieutenant General, but you've seen his passion for public service. And I think if there is anything that we have done, and especially for younger people like me, is to prove that public service can work, with discipline, with the dedication, with lack of interest, that you can deliver services. That if you want people of Mukuru to get health services, we've just done 2 hospitals in Mukuru kwa Chenga, Mukuru kwa Ruben, that you can actually do it. You can do it without a lot of hula baloo, and people can get the service. And I think that's the most important thing. And for me, I think that's the satisfaction.
But it seems like a thankless job. At the end of the day, come on, let's face it.
Yeah. Huh? But I think Wananchi really appreciate, Wananchi. if you ask any doctor in any country or in this country, I think, or any nurse, for example, I think even for you, Jeff, I think sometimes work is not just about reward. Work is also about dignity. It's about satisfaction. It's about getting value that I was useful for my country. Yeah, and I think that if we were all to look for people, like thanking us, no one would be in KDF, for example. I think so, because if, for example, the guys who went to Somalia, even people who lost their lives, the healthcare workers who lost their lives during COVID, I think no one would do this kind of jobs. So someone has to do the hard job. Someone has to do the dirty job, and sometimes in every society you must have those that are in the front line to protect everyone. So I think we are doing it with passion, and we love what we are doing, and I think. And I see it every day. I see the 200 people who go to Gatina or Kiamaiko, and sometimes they send for us, SMSs. Sometimes they even just meet you. And they may not be the people on Twitter or Facebook or the ones who know us, to talk about it. But they are grateful. They are grateful that their lives could be changed, or that someone's child lived because a hospital was put up in Tasia. You can, if you are living in Embakasi, you should be able to know that there's a level 3B in Tasia, where if you have a pregnancy and you don't need to go very far to look for a place to deliver, even if that delivery is complicated and needs a cesarean section, we have 5 doctors there, we have a theater there, we have all these things. I think it's important for us to sensitize the public about that. But also what we are used to in Kenya is what we call show, where you talk about things that don't exist. And I think for us in N.M.S, we took a bit of a backseat. So you want to do the work, and once you do the work, then now you can tell people, oh, hey, there's a hospital in Kibra. Please, if you are suffering, you don't have to go to Bagathi, or you don't have to go to KNH. You can go to Kibra. And we think that is something that should be emulated in terms of, so that we don't have a lot of noise, but on the ground, vitu ni tofauti.
Let me ask you, in the recent past and before COVID, there was a strike or two every so often because of our medical practitioners.
Yes.
Now that you're in that position, are you taking good care of them? Remember, nurses are listening. No, what is with the time? Listen.
We have tried. Yeah, we've tried because, we spent 600 million shillings just promoting healthcare workers.
What do you mean promoting? Oh, like elevating them from rank to rank.
Rank,
okay.
Yeah. There is no single doctor, for example, that is below job group N. All the nurses, we have promoted them. There are 2 issues with the nurses now, which is a bit of a difficulty in terms of their what they call harmonization. So we have 2 groups. We have the ones that were inherited from the city council even before the county came, and they are on a collective bargaining agreement that they have signed between the county government and the county government workers union. And then there are the other nurses, which are members of the Kenya National Union of Nurses, who mostly, they also have a CBA, but their CBA is more structured within the civil service scheme of service. So you find that they have 2 different terms, and for us, we've said we can solve the problem, but they have to choose which side they want to be. You can't want the menu of Crown Plaza and want the food of some other hotel, So I think this is the thing. So we have to harmonize, but that harmonization is also a difficult choice on the nurses side, because we have to engage them, and I think our HR directorate is doing quite a good job in terms of talking to them and dealing with those issues. But in terms of promotions, in terms of employment, I just mentioned, we've done 790 nurses who have been employed. In fact, we have almost doubled. We only found 1,400 nurses. Now we have 2,200 nurses.
Yeah, so you some of them are leaving town. Some of them are fleeing the country. I guess
the ones that are remaining, are they good in English?
Are they at least speak the language?
So we've done quite, and I think they can confirm for themselves that we've done quite some work in terms of HR, because you don't have any health service without the HR.
Yes.
And we want to thank them, because Nairobi, as I mentioned to you, is a very unique place. So the volumes are high. This is the epicenter for COVID, and our healthcare workers have done an amazing job.
What's the plan in decongesting Mama Lucy Hospital to allow referrals only from Eastlands area?
First of all, Mama Lucy is celebrating 10 years this December.
Wow.
As you know, it was named after the former First Lady, Mama Lucy Kibaki. And initially it was called Embakasi District. A small hospital was expanded with the government support, but they only did phase 1. So Mama Lucy is only 132 bed capacity, at least when we found it, serving a population of 2.1 million people.
Wow.
And so when you go to Mama Lucy and you find 2 or 3 people sharing beds, the first reaction is like, oh, what is this, But if you look at the population that it's serving and the demand there, it's quite huge. So what we've done is we've expanded the capacity of Mama Lucy, first of all. So we've just operationalized the 66 bed capacity to expand the bed capacity to 180. Through the support of the World Bank, we've done quite a bit of work there, even putting an infectious disease unit and an ICU. But we have just also started expansion for another 180 bed facility, which is going to now make the whole complex 360 beds. That's just for Mama Lucy, and I think around Mama Lucy are 9 hospitals that are coming up. Which is level 2 and level 3. So if from the far end, of course, I mentioned Zimmerman, then there's Githurai, then there's Kamulu, and then you have Tasia kwa Ndege, and then you have Mukuru kwa Ruben, Mukuru kwa Njenga, then you have Kiamaiko, and then you have Kayole Soweto, and then you have Gumba in Madare. So these are 9 hospitals, and those 9 hospitals, their work is supposed to decongest Mama Lucy Kibaki Hospital, so that it's a level 4 facility. It's supposed to be elevated to a level 5, so that it can also do its work the same way it has happened with KNH. It's supposed to happen with Mama Lucy Kibaki Hospital. So this, and also of course when the level 5 opens in Madare Korogosho, I think the numbers are going to certainly go down. So Mama Lucy Kibaki Hospital is, I do agree, is quite congested, and we are doing quite a lot of work. So we've already commissioned the Mukuru kwa Ruben, Mukuru kwa Njenga. Tasia is already functional. Kamulu is functional. Githurai is not yet open. Zimmerman is open. Kayole, Soweto, and Kiamaiko are open. And when Madare Korogosho level 5 is open, I think we're going to finally achieve the dream of giving quality care for people who go to Mama Lucy Kibaki Hospital.
Are there plans also to, like most of these neighborhoods would also have like very random, unqualified, unprofessional people just setting up their own hospitals?
One of the things we found in Mukuru, and it is there in the report, when they were doing the Nairobi regeneration report, they found 207 chemists or clinics, all of them not registered. So you can imagine the danger, because you're going to see quacks. But you see also, if we as government we haven't put up a facility that then can guarantee proper treatment and care, then that's how also some of these people are mushrooming in terms of the quacks. So the first step, and I think eventually they'll run out of town. They'll run out of, because what will they be doing if you have free service that is quality? But of course we are calling it free, but we are encouraging everyone to have an NHIF card, so that there is sustainability in terms of financing of these services. Then the quacks will definitely run out of town.
We must ask you finally, before we let you go, the COVID situation in Nairobi County.
Yes.
It's been contained. Are you able to contain it for now, especially since the lifting of the curfew?
Yes, so we've first we want to thank Nairobians. Nairobi has been the epicenter, so more than 130,000 cases. And from the beginning, this is the place where we were doing quarantine for travelers, and so it's a high transit region. So our COVID situation was so bad in March and then also around July, but right now it's fully contained. Nairobi is leading in terms of, I think you've seen the vaccination. We are at around 34% of our adult population fully vaccinated. If you are looking at people who've gotten just one dose, then we are more than 50% of the adult population in Nairobi. But we are still calling upon everyone to come for their second dose of vaccination, to come for the first dose of vaccination. We now have isolation center in Bagathi. We have an isolation center at Mamalusi. We have a lot of work that has happened with the community as far as mobilization for vaccination is concerned, but also just for preventive measures. So, Nairobi is a very unique place, because if you go to places, again, the informal settlement I'm talking about, and you see the settlements, the houses, the way they are, one after the other, there's a lot of congestion that even isolation was difficult. And that's part of why the general has been very clear about the investment in water, because you're telling people to wash their hands, but wash their hands with what? So those are part of the investments that were done so that we can be able to contain COVID. So yes, our COVID numbers are quite low now, and we want to keep them that way. So we're still encouraging people to keep social distance, to make sure that they get vaccinated, to make sure that they are washing their hands regularly, because we want to prevent the next pandemic. Nairobi, we've lost quite a lot of people, 1,500, and these are breadwinners, because everyone who is in Nairobi is here to work, and so the chain of loss of life, or even COVID in itself, as far as the economy is concerned, is quite costly.
It's a tough job. It's a thankless job, but someone has to do it.
Someone has to do it.
Thanks so much for your time.